Good evening. Good evening. It is Sunday, March 10th. How's everybody doing? It's Dr. Jared. What's going on? What's going on? So, I wanted to do a quick live for y'all. Hopefully, you guys were able to spring forward. And I hope that that hour of sleep didn't affect you guys too much. But I wanted to come on and do a quick live because we got to talk about a couple of things. All right. We got to talk about veneers. Listen, y'all, one size does not fit all. But before we talk about veneers, let me tell you guys who I am. I am Dr. Jared. I am America's favorite dentist. I create healthy, beautiful smiles. Listen, dentistry is an art form, and I consider myself to be the Picasso of dentistry. Listen, this is what we do. You know, I come on, I hop on these lives. I'm doing a dual broadcast tonight, Facebook and Instagram. And tonight we are going to break things down when it comes to veneers. I don't want there to be any misunderstanding tonight after discussing what veneers are, because I think media may be misleading y'all, and I want to make it plain and simple and clear so that you know how to approach your dentist in dealing with veneers. All right. So once again, I'm Dr. Jared, America's favorite dentist. You can follow me here on Instagram and Facebook at drjared_DDS. My office is JLM Dentistry in Smyrna, Georgia. It's outside of Atlanta. If you are looking for a dentist and you're in the Atlanta area, I'm your girl. Yes. Kristen asked, how come some people's veneers look like iPads? We'll talk about it, Kristen. We're going to talk about it. But if you are in need of a dentist, definitely check me out. We're on Facebook, on Instagram, www.facebook.com/Dr. Jared DDS. Also, my office page is www.facebook.com/JLM Dentistry. That's JLMDENTESTRY. And office number is 770-433-1515. I'm waving to everybody on Instagram. What's up, y'all? Thank you guys for joining in. You know, it's been a little while since I've done a live video, but this is really, really important. So let's break it down. First, let's talk about what veneers are and why are they used. So I think a lot of celebrities are misleading the people. I'm just gonna keep it real. Veneers are not one size fit all. Absolutely not. Veneers are basically a thin piece of material. Usually it's porcelain or lithium silicate. I don't want to get into all the details of material, but it's a thin piece of material that basically covers the teeth. It covers the teeth in such a way that it recreates someone's smile. All right? Hey, Dr. Candace, how you doing? That basically is the gist of what veneers are. We veneer teeth that are in people's smile lines. So somebody may have a bigger smile than another person. So basically, if I'm smiling, regular smile, you know, you see more than 6 teeth, because a lot of people like to veneer 6 teeth. But if you have 8 teeth, or if you have 10 teeth in the smile line, those are the teeth we want to veneer, because we want to make sure that everything looks natural and balanced and in harmony. All right, that's one thing. So we talked about what veneers are and why they are used. Thin piece of material, usually porcelain, that usually cover the front of people's teeth, the teeth in the smile line. Hey, Sandra, thank you for joining. Hey, Kizzy, I see you, girl. Thanks for joining. I see all of y'all. I appreciate y'all for joining me. So we talked about what veneers are and why they are used. Let's talk about the process. I keep saying it. It's not one size fit all. I think I saw something recently on the internet about somebody purchasing veneers from Amazon. Say what? How? Hey, Trina, what's going on? That does not work, y'all. Hey, Sarah. Hey. That is not how this is made. The process, basically, these veneers are custom made, all right? It's not a one-size-fit-all type thing. Hey, Sonia, thanks for joining. Veneers are custom made. They're bonded to the teeth. And like I said, not one size fit all. I'm going to keep saying that all night tonight during this broadcast. Not one size fit all. It is a very technique sensitive process. Yes, basically what we're doing is preparing the tooth or the teeth, and we're removing tooth structure, right? We're removing tooth structure. After we remove tooth structure, we take an impression or a mold of the teeth, and you will leave the office in temporary veneers, all right? Those temporary veneers will last you until the lab is able to make the veneers. So basically, when the lab makes the veneers, we get you back into the office and we are going to bond the veneers to the front of your teeth. Hey, Treva. Hey, Doc. Everybody's joining. Hey, John. You need them, John? Well, you know who to call if you need veneers. I'm your girl. Listen, so usually it is a 2-appointment process. So no, yes, you should not order them online. Absolutely not. You can order them online if you want to. If you want to look like everybody else, looking like Bucky Beaver, that's perfectly fine. But if you want something natural looking, then you definitely want to see a licensed dentist that has experience. Well, Sandra, if you're in Atlanta, even if you're not in Atlanta, come see me. I'm a licensed dentist that knows exactly what they're doing. All right. So basically, let me revisit the process. Custom made, bonded to the teeth. All right. Veneers are custom made and they're bonded to the teeth. It's not a one size fit all process. It's very technique sensitive. Basically, we are removing tooth structure off the front portion of your teeth. We prepare the teeth and we take an impression or a mold of the teeth. After that, you usually leave with temporary veneers after that first appointment. And then the second appointment, we get you back after the teeth have been made and fabricated by the lab. Then we get you back, try the veneers in. We bond the veneers to the teeth. And like I said, in most cases, it's a 2-appointment process. Listen, veneers is considered cosmetic dentistry. So I always make sure that you see the teeth before we finalize anything, because yes, I might love it, but you absolutely have to like it too. All right. So we've talked about what veneers are. We've talked about why they are used. We've talked about the process. Kristen asked if veneers are strictly cosmetic or do they have some clinical use? In most cases, veneers are cosmetic. All right. Basically, when insurance is involved, they look at that as being cosmetic and they are not going to pay for it. If you have dental insurance, they typically don't pay for it. I don't treat people's dental insurance. I treat you as a patient, as a person. And most dentists do that as well. So, but definitely all types of cosmetic procedures, insurances are not going to cover. So things like veneers or whitening, those are cosmetic procedures that they consider to be cosmetic. And in most cases, they don't cover those things. So we've talked about the process. We've talked about what veneers are and why they're used. Let's talk about how to take care of them once you actually have them. So basically, as I preach to y'all all the time, regularly brushing and flossing. That means brushing and flossing twice a day, every day, is what you should do to help take care of the veneers that you have. And seeing your dentist regularly. For some people, that means seeing a dentist twice a year. Some people, that means seeing a dentist 3 times a year. And sometimes 4 times a year. It is a customized process. Let me kind of backtrack a little bit, let you guys know again, yes, it's Dr. Jared. If you would do me a favor and share the broadcast with your friends, definitely on Facebook. To the left of the screen, there should be a share button. If I say something that you like, you love, of course, hit the hearts, hit the like button. That lets me know that I'm informing you guys, right? So listen, taking care of your teeth, brushing and flossing twice a day. You know, I preach that. That's probably like the very first broadcast I've done, talking about brushing, flossing twice a day. That is the basic that you need to do in helping to keep your teeth. You treat veneers as if they are your own teeth, because actually it's your own teeth underneath, right? So we want you to treat them like it's your own, all right? And then also, I mentioned seeing a dentist regularly, but we want you to limit things that stain your teeth. I can't tell you not to drink the coffee. Can't tell you not to have the red wine. I like red wine occasionally. I just want you to limit those things because we don't want to stain something that you've invested your time, money, and energy into. These are things that will help you keep your teeth and keep your smile lasting for a long time. So here's the deal. Veneers is a man-made process. Having veneers is a man-made process. So most things in dentistry are absolutely not going to last forever because it's man-made. But if you follow those steps, you should have a long-lasting smile if you get veneers. The question is, do veneers sensitize the teeth? They should not cause sensitivity. If you're having sensitivity with veneers, you should go back to see your dentist. You should not have sensitivity. All right, so we've talked about what veneers are, why they're used. We talked about the process of having veneers done. Let's talk about a couple other things. Just some sidebars. If you're considering doing veneers and you're considering whitening, you want to whiten your teeth first, right? Reason being is because when you whiten teeth, you can only whiten the natural teeth. I know there's some products out there that tell you you can whiten crowns and bridges and all that good stuff. Don't believe the hype. You are only going to be able to whiten your natural teeth. So once you whiten your natural teeth, you get the shade that you desire. Then we do veneers and we match the shade of your veneers to the shade of your natural teeth. Make sense? All right. Hey, Danette, thanks for joining. Let's see, what else? Sometimes veneers is just not enough. Sometimes you do braces first and align the teeth in the better position. And then in some instances, you still have to do veneers afterwards. I had a patient recently, just got out of braces. She came to see me for a consultation. She had a few small spaces that still were there with braces because sometimes braces doesn't close all the spaces that you have. So what we ended up doing was veneering a few of her teeth to create a natural, harmonious smile. So sometimes you have to do braces. And another thing that comes along with doing veneers is contouring, gum recontouring. Sometimes, and you know, a lot of people look at my teeth and say, hey, they look great. I mean, my teeth should look good, right? At least halfway decent, right? Because I'm a dentist, catch. But sometimes if you're going with veneers, you want to make sure the gum line, the area above the teeth, you want to make sure your gum line is in harmony as well. Some teeth, you know, this lateral tooth over here and the gum line on this lateral tooth on this side can typically look completely different from each other. But we want to make sure that they look the same and are in harmony with each other. So sometimes gum recontouring is necessary when doing veneers. Sometimes if people have a very high gum line, you know, they smile big, you see this top area. Sometimes we go in to recontour the gum tissue to adjust the gum line. You got, Kristen, if you have questions, you know I got answers. Hey, Dr. Kwanzaa, what's up? What's up? Are veneers the only way to conceal black triangles after braces? It is one way to conceal black triangles. I have black triangles, you know, I just live with them because sometimes, I mean, it's not a huge deal. Veneers is one particular way. They're not the only way. Sometimes when you have braces, you move teeth, but your gums move, but there may be some areas that the gums don't move. And that is something that could create a black triangle. Recession of the gum line also can create a black triangle. So several different things cause a black triangle, not just braces. Kwanzaa, Dr. Kwanzaa says, yes, all colors are not created equal. They're not. She also asked, do you have to have braces to get veneers? Do you have to have braces to get veneers? No, you don't. You don't. Sometimes people get braces and that's all they need. I just finished up a case of Invisalign. Night and day. I think I posted it recently. If you go back to a couple of my more recent posts within the last month, night and day, y'all. This guy came in and all he needed was Invisalign, and his smile it transformed his smile, his face, his facial features, and he has said that he can't keep the women off of him. Okay, whatever. All right, but sometimes all you need is braces. But like I said, sometimes you need the combination. Hey, Cherie, thanks for joining. Hey, Doc, everybody's joining. Everybody's on. Thank y'all for joining. So those are a couple of things. Again, I'm Dr. Jared. If you wouldn't mind, just share the broadcast with your friends and family so they know what we're talking about. Veneers, veneers, veneers. That's what we're talking about. But here is one big important thing when it comes to veneers, any cosmetic treatment, any dental treatment in general. Hey, Dr. Lakeisha, thanks for joining. Hey, Lori, thanks for joining. Listen, you have to seek advice from a qualified, licensed dental professional. Let me backtrack. A qualified licensed dentist, not a dental professional. When we're talking about veneers and you're paying somebody to do some work and you having treatment done, a dentist who is licensed, who has a degree and is called doctor, is who you should be seeing to have your dental work done. I know a lot of people are going overseas or out of the country to have dental work done. Listen, that is your prerogative, but I would much rather go to someone that knows exactly what they're doing. They have the credentials to back it. They have the reviews to back it. Or you know someone that has gone to that person. So it's a word of mouth situation, or you were referred by a friend of the family or a friend. So please, please, please do your due diligence. Listen, you are paying money to have this work done. Veneers are not cheap. This is, Krista says she's staying stateside. Yes, I would stay stateside. It's just me, you know. But veneers are not cheap. So you are investing in, it's a smile makeover. It's a makeover of yourself. So I would suggest that you have it done by someone who knows what they're doing. All right. What to expect. So let's talk about what to expect. Stephanie asks, let me backtrack. Would veneers be the best option for overbites? Stephanie, so let me say, well, first of all, thank you for joining, but let me say this. If you're talking about an overbite, your better option, it sounds like, without, knowing like all the details, it's you, Stephanie. Okay. The best option would be to start out with braces. That would probably be the best option to start. But we can definitely discuss all of that when you see me again. But braces would definitely be the better option. Kizzy asks, are they like dentures and have to be replaced after a certain length of time? So I addressed that too, Kizzy. Nothing in dentistry is going to last you forever. It is a strong possibility, yes, that they have to be replaced. But if done the proper way and by a licensed dental professional who has experience in doing veneers, they should last you a very long time. Thanks, Kathy, for joining. I appreciate you joining me. So what to expect at your consultation? Yes, you should have a consultation appointment. Let me tell you what to expect at the consultation appointment at JLM Dentistry with me, Dr. Jared. Basically, we are going to sit down and we will discuss what you're looking for, what your ultimate outcome, what you desire. Thanks, Cherie. Thank you so much. I take pride in that. I really feel like that if you're coming to see a dentist, and especially if it's something cosmetic, I think that I really need to be a walking billboard for myself. Like, I don't think you should come see someone who has bad teeth. That's just me. I like to practice what I preach. But you come to me first for a consultation. We sit down and we discuss your needs and desires when it comes to improving your smile. I always preach health first. So if you come to me and you don't have the healthiest smile, then know that we're going to get you healthy first. Veneers are not an option if the foundation is jacked up. Thanks, Sora. Thank you so much. Veneers is not an option if the foundation, meaning your teeth and gums, are jacked up. You have to have health first, all right? That's over everything, all right? So we sit down, we have a discussion about where you see yourself or what you want to be, all right? Where you want to be. That's the first thing we discuss. We discuss where you want to be. It is key that we take pictures of your teeth from all angles. We take pictures of your facial profile. Hey, Travis, thanks for joining. Hey, Dr. Joya, thanks for joining. It's a lot of dentists on here too. Look, we support each other. We support each other. It's all love. Dr. Joya is in North Carolina. If anybody is on here in North Carolina looking for a dentist, kind of the Charlotte area, right? Dr. Joya, remind me. But so we first talk about what your expectations. All right. We sit down and talk about your expectations. After that, we're going to take pictures of your teeth from all angles, take pictures of your facial profile. What I also like to do is take impressions of your teeth, and we take a mold of your teeth. We send that mold to the lab. The lab actually, I collaborate with the lab, and we come up with a game plan. They will send me back a model of what your teeth could look like. So then we get you back and in about a few weeks, and we get you back, look at that model and see if you like the model. First of all, I look at the model and I approve the model. Hey, Miss Janie, I see you. Thank you for joining. I look at the model and we discuss what's good about it. Hey, Dr. Holly, what's up? My Xavier crew is in here real strong. We look at the model, we discuss the good and bad of the model. But once the model looks good to me, I show you. And basically what you're seeing is a diagnostic waxed up model of what your teeth can look like once the veneers are done. So you kind of get a glimpse of the after when you look at these models. Hey, Nikki, Moss Point's representing here too. I see y'all. So basically, when you come to me initially, you may be looking at 1 to 2 appointments before we actually sit down to start the treatment. And then when we start the treatment, that is a 2-appointment process. All right. So during this appointment, the consultation appointment is when we start discussing the whole process. We discuss pricing. Pricing is always important with people. Listen, this is elective dentistry. It is cosmetic dentistry. It is you investing. It is quality. It is not going to be cheap. A lot of people want a price and a price range. A lot of that depends on, it is determined when you come to see me and sit in the chair and we discuss all aspects of your teeth. Monica says I have a tooth removed on the side, so a small gap that I've had in the front has gotten bigger. What are some options to correct that? Thought about veneers. Yes, veneers could be an option, Monica. Braces can be an option. A combination of braces and veneers can be an option. So, but like I said, no, I keep calling you Monica. It's Moni. I'm sorry. But like I said, it would really take me looking at your overall smile and coming up with a detailed game plan to kind of know what's going on. Hey, Jamie, thank you for joining. Got my family in here too. So I have talked about a lot of stuff when it comes to veneers. But listen, here is the deal. This is about recreating your smile. All right. We are recreating your smile. But not only that, y'all, the bigger picture is that this is not just about your smile. This is a game changer. This is about recreating self-esteem. This is about recreating confidence. This is about investing in you. Listen, some people are walking around with really bad smiles, unhealthy smiles, and those same people come and see a dentist and decide to invest in themselves. And investing in themselves is transformative. It's life-changing. When I say it's life-changing, it means it can be what gets you married. I mean, a smile it says it all. It is everything. It could be the thing that gets you married. It could be the thing that finally lands you a job. A lot of people don't look at the bigger picture, but we take this seriously. It is not just about changing teeth. It's about changing your lives. So I hope this information has helped. If you guys want to reach out to me, feel free to inbox me on social media, on Instagram, I'm at Dr. Jarrett _DDS. That's DRJARRETT _DDS. Facebook, Dr. Jarrett DDS. Also, my office is here on Facebook, JLM Dentistry. I'm also on Instagram at JLM Dentistry, Instagram and Twitter. I'm all over the place. You can't miss me. I appreciate y'all staying on a little long. Yes, Kristen, it is about investing. You're going to have your teeth for the rest of your lives. Like, my mission as a dentist is to make sure that you have what you have now for the rest of your life. If we need to enhance and add a little bit here and there, let's do that to help improve your overall health, to help you eat, to help you function, to keep things balanced, and to get you that second date. I'm just saying. All right, so I appreciate you guys staying on. I just got off spring break. Lovely time in Puerto Vallarta with the family. I'm gonna be back to the grind next week. So I appreciate you guys staying on, spending your Sunday with me for a few minutes. Stay tuned, of course, of some more things from me. And let me just also interject and say, yes, I'm Dr. Jarrett, but what you would catch on my page is all facets of my life and all aspects of my life. I got some major things coming up. I will be sharing that with you. I'm really, really excited about what's coming up for me and my family, because as I've told you before, it is about securing the legacy for me. Everything that I do, it is about securing the legacy for my child and her future kids and her family. So I appreciate all the support. I have some big things coming up, especially for my ladies that are Team Natural. So you stay tuned. But I love y'all. I appreciate y'all. Of course, I will be periodically giving you guys live videos on all aspects of dentistry. Hit me up. Let me know if there are some topics that you want me to discuss or revisit. But I'll be here. I'm here. You guys have an awesome week. And I will see you next time. Bye.